and my own. Sir has published 10 articles and titled 7 dissertations and many more. So ladies and gentlemen, please join me in welcoming Dr. Vinaykumar Hiremath sir.
दूसरे वक्ता आज के जिनको मैं अपने बचपन से जानता हूँ, वो जहाँ जहाँ है वहाँ वहाँ मैं गया हूँ और जहाँ उन्होंने पढ़ा मैं वहाँ पे पढ़ा। जब वो पढ़ाने शुरू किया तो मैं उनसे पढ़ा लिया और अभी हम दोनों मिलके पढ़ा रहे हैं। तो ऐसे वैद्य महेश सालिमठ सर को मैं सभा पे निमंत्रित करता हूँ। प्लीज आइए सर।
Dr. Mahesh Salimath sir, a dynamic academician and clinician, holds a PhD in Ayurveda and is renowned for his contributions to Sambhasha and yoga. In 14 years of teaching experience in Ayurveda, over 17 years of clinical practice integrating Ayurveda, yoga and naturopathy, sir is a pioneer in innovative teaching methodologies and preventive healthcare. Dr. Mahesh sir has published over 200 articles in leading newspapers, delivered talks on all India radio, spearheaded various national and international seminars and workshops. Sir is a recipient of Karnataka Rajyotsava Prashasti from Vishwa Kannada Balaga for Vaidhikya Seva. So ladies and gentlemen, please join me in welcoming Dr. Mahesh Salimath sir.
इस सभी कॉलेज में बहुत डिफिकल्टीज है। डॉक्यूमेंट्स करो, ये करो, इंस्पेक्शन आता है, वो आता है। ये सभी को ऑर्गेनाइज करके सभी कॉलेजेस को बिजी रखने वाले जो व्यक्ति है वो डॉक्टर प्रमोद कट्टी है। तो कट्टी पे बैठ के बहुत कुछ करते रहते हैं लोग। कट्टी के ऊपर बैठ कट्टी यानी किसी जगह पे कोने में बैठ के बहुत सोचते हैं और दूसरों को प्रॉब्लमेटिक करके संस्था को सुधारण करने की दृष्टि से, किसी को तकलीफ देने की दृष्टि से नहीं, संस्था को सुधारण करने की दृष्टि से बहुत कुछ काम कर रहे हैं डॉक्टर भाई प्रमोद कट्टी सर। मैं उनको यहाँ पे निमंत्रित करता हूँ। आज के को रिसोर्स पर्सन है सर, प्लीज आइए।
Dr. Pramod Katti sir is a professor in the Department of PG Studies in Chikitsa tatha and Hospital Hubli. In 25 years of clinical and 20 years of teaching experience, sir has contributed many things to the field of Ayurveda. Sir is highly respected by the students of Ayurveda for his unparalleled teaching skills, practical applications and understanding subtle concepts in Sambhasha. Sir has given a number of Ayurveda awareness talks on many TV shows and interviews. Belong to the family of traditional Ayurveda practitioners for 9 decades and 3 generations, having vast clinical experience of 25 years in the field of metabolic disorders, endocrine disorders, infertility, CKD, infectious and inflammatory disorders, allergy and autoimmune diseases and many systemic illnesses. We are so honored and blessed to listen to this session. Ladies and gentlemen, please join me in welcoming Dr. Pramod Katti sir.
जैसे मैंने बताया कि 2 इवेंट बाकी है, एक ये सेशन है और दूसरा मोस्ट अवेटेड अनाउंसमेंट ऑफ प्राइजेस फॉर प्रधानमंत्री विषय मंडल चरका फर्स्ट सेकंड थर्ड, सुश्रुता फर्स्ट सेकंड थर्ड एंड वागफटा फर्स्ट सेकंड थर्ड prizes. So all are eagerly waiting for that. We definitely know it and we really appreciate your waiting time and your way of waiting with pain or without pain. But it will be carried after the session immediately, and post prize giving ceremony, we will be moving for the lunch, and that's where the event closes. Formal functions we finished on day 5th, hence only we are awaited with prize giving event that will be on. The prizes will be given to the scholars, winners by none other than legendary Vaidya Anand Dharmadikari sir, which would be the wish and will of every presenter to get the prize and get honored by Vaidya Guru Anand Dharmadikari sir, and Trilok Bhupeshwarkar sir will also join in the prize giving movement. So, before beginning, for 2 minutes, Dr. Hiremath sir wants to address, and post that Vinaykumar Hiremath sir will definitely start with moderation. Thank you, sir. Please.
Om Shri Guru Namaha. Ajnanatimirandasya Jnananjana Shalakaya Chakshurunmilitamena Tasmai Shri Gurave Namaha. Respected Dharmadikar sir, Pramod Katti sir, Hiremath sir, Salimath sir, this function may backbone or backbone sir and all dear students. Really, I am so much happy to be here. Only 5 students are visiting both. Oh, my another work is that. But after seeing that, you and here of temple, that piece of this place, really amazing. You feel it. I feel it. Maybe you feel it. That's been 5 days. Your face looks like, I don't know, class, the students are, yes, but here, everybody is smiling face. Very enthusiastic, learning something. Really, this is Gurukula. But very difficult to say Gurukula. But really, sir, hats off to you. Really, I have seen the Gurukula. So, Dharmadika, when I was in Hasa, yes, I know only Dharmadika is, only that word. So, I tell Dharmadika, sir, I don't know, sir, it's really the first time. That word, really, sir, you are a Dharmadika of Samhitas. Dharmadikari, very one name is there, sir. But when I had this 1 hour, 30 minutes I had listened words, very nice, all words are. And correlation, even Samhita, Samhita, reference, chapter, as a teacher, really sensitive, sir. Really love Dharmadikari. Thank you for being a host. Thank you. Please.
उपस्थित सभी गुरुजनों को शत शत प्रणाम। आयुः कामायमानेन धर्मार्थ सुख साधनम् आयुर्वेदोपदेशेषु विधेयः परमार्थः। That second part, Ayurveda Upadesheshu Videya Paramadaraha, that has been seen since last 5 sessions, 5 days, what Dr. Sroto Vikaranam and team are struggled so long to achieve this success of conducting the 5th edition of tadvidyasambhasha parishad. Initially, I wholeheartedly congratulate and compliment Dr. Sroto Vikaranam sir and his team for organizing such a meaningful event for Ayurveda, live Ayurveda, love Ayurveda, and learn to practice Ayurveda. To begin with the topic, Medo-Pranavaha Sroto Vikaranam. See, it has been told in the Samhitas, Yavantaha Purushe Murtimanto Bhava Vishesha Tavantaha Evasmin Srodasam Prakara Vishesha. The Purusha himself is a samudaya of Srodasas, amongst which Acharya Charaka has enumerated 30, Acharya Sushruta has enumerated 11 base. That's all theoretical apart. This particular topic is chosen by the organizers very yuktignya, right? And they have chosen 2 stalwarts here. One belonging to the Kaya Chikitsa, Dr. Pramod Katti sir, and one belonging to the Swasthana department, Dr. Mahesh Salimath sir. See, what is the prayojan of Shastra? Swasthasya, Swasthya Rakshanam, Ardurasya, Vikar Prashanam. One is here to give us the second part, one is here to give us the first part. To begin with, I request Dr. Pramod Katti sir to start up. See how beautifully he has coined the title Medo-Pranavaha Sroto Vyadhis pertaining to the Medo-Pranavaha Sroto, a clinician's appraisal. Whatever the Shastra Jnana you gain in the classes, how that could be incorporated and utilized clinically, that will be dealt by Dr. Pramod Katti sir. I request Dr. Pramod Katti sir to begin with his presentation. And any queries, just raise your hands in between. We'll just take up, we'll discuss. It's not like a theory class, you must sit quiet for 1 hour and listen, just listen. No. It will be a discussion. Wherever you people feel to raise a question, you just raise your hand, I'll be there.
धन्यवाद आदरणीय महाप्रभु जी, समस्त वैद्यगण एवं समस्त विद्यार्थीगण, मेरे इस मंच पे मेरे साथी वैद्य हिरेमथ जी, वैद्य सालिमथ जी, I am extremely thankful for the organizers for giving us this opportunity to make an interaction with all of you. Past 4 days, all have gone through the different samhitas, the different stalwarts across country. मैं संहिता का अध्ययन करने वाला व्यक्ति नहीं हूँ, मैं सिर्फ और सिर्फ उससे प्रेरित होकर प्रैक्टिस करने वाला व्यक्ति हूँ। तो संहिताओं में मेरा उतना ज्ञान नहीं है, जितना भी मुझे पता है उससे मैं मेरे अपने प्रयास से प्रयत्न से आपके सामने मुझे जितना भी पता है मैं आपके सामने शेयर करने की प्रयास करता हूँ। इसमें से जो भी गलती है वो मेरी है, इसमें से जो भी अच्छी चीज़ है वो सभी मेरे विद्वत गुरुजनों का है। मेदो-परावाह स्रोतस, मैं उसका क्या मेदो-परावाह स्रोतस है, मूल क्या है, वो सभी के ऊपर मैं नहीं जाऊँगा। I directly go into the subject which will help you to practice in your future. So all the metabolic disorders, all the Sankalpanotha Vyadhis, where Kapha and Mega and Pitta doshas are basically involved, obscuring the Vata dosha or making avarana to the Vata dosha, producing multiple diseases in multiple systems. The Vyadhis which are produced from the involvement of the Meda Dhatu does not involve only Medo-Pranavaha Srotas. It involves multi-organs, multi-systems. That is why we are seeing so many diseases out of Sankalpanotha Vyadhis. Similarly, encountered in modern medicine as a metabolic disorders. So what are the metabolic disorders? You will get prameha or hypertension, dyslipidemia, cardiac or circulatory diseases, or NASH, that is non-alcoholic state of hepatitis, PCOD or PCOS, cancer or dementia, type 3 diabetes. What is type 3 diabetes? We know type 1, we know type 2. What is type 3? It is the dementia. Type 3 is Alzheimer's disease. So now they are coming up with the linkage between Medo-Pranavaha Srotas in connection with Majja-Pranavaha Srotas, in connection with manifestation of Alzheimer's disease. That is type 3 diabetes. So dementia. So these are the infographics, the diseases which comes under the group of Sankalpanotha Vyadhis. So if you go to all the Sankalpanotha Vyadhis, you will also get all these diseases. The same thing what you are learning in entire pathological books of modern medicine. So nothing is new. The same thing what our acharyas have dealt. The same thing you are going to observe. The death has a preponed nowadays because of metabolic disorders. Insulin resistance leads to type 2 diabetes, steatohepatitis, atherosclerosis, arteriosclerosis, I'll come to those points, hypertension, manifestation of stroke. So, the base cause for all these diseases in this left side, cancer, even Pranavaha Sroto Vikaranam, sleep apnea, even the osteoarthritis, Sambhasha vata, how come Sambhasha vata is interconnected, where the vata is getting aggravated. So, the line of treatment in a school of Sambhasha vata changes as compared to a person who is a Krishna. So, the line of treatment varies. So, you need not give always Vata Chikitsa and Sambhasha vata. If you do Medo-Pranavaha Chikitsa, one simple Medo-Pranavaha will relieve the pain in Sambhasha vata. One Langana, one Udvarpana, one Lekhana Vasti will relieve the pain in Sambhasha vata. So it is not only the treating of Vata dosha and Sambhasha vata. So you have to look into multiple dimensions of one Vyadi, maybe Swatantra or Tantra or whatever maybe it is. So that is why for all the things, the Santarpana becomes the basic cause of all multiple diseases. So sleep apnea, neurodegenerative disorders and hepatobiliary disorders. That is why Acharya Sushruta says, almost all the Vyadis are born out of Rasanimitta Niva, including Karshya and Sthaurya. I am not going to detail about the slokas. So, apatya nimitta jo prameha. Apatya nimitta jo prameha and apatya nimitta jo prameha, two different contexts which have been explained by Acharya Sushruta. Because of ahar vihar, apatya nimitta jo prameha, sahaja prameha, apatya nimitta jo prameha. So two different contexts which have been explained by Acharya Sushruta. How you are going to clinically identify apatya nimitta jo prameha? Patient is obese. Patient is stoola. So BMI is more than 24, more than 30, more than 32. Or sudden rise of weight, sudden gain in the weight over a period of 6 months or 1 year. That could be one of the indicators that a person may suffer from prameha in future or pre-diabetic stage. So stoola and snigdha or snigdha sharira, snigdha tvacha, bahuvāshi. So polyphagia, bahuvāshi. So hepatitis increased, bahuvāshi. Shayyasana, continuously sitting in one place, lethargic. So he could not be able to carry out his routine activities. Further, swapnashila. So these are the things from Samhita to practice we can identify. Atisthula also have genetical predisposition. That is why Sahaja Prameha is also explained under this particular context. Not as apatya nimittaja, it is apatya nimittaja. Bija Swabhava, Medo Saratva, Nudu Vichara Guna, Prakriti of Kapadosha, then the sedentary lifestyle, followed by all the Atisthula Lakshanas. Later, apatya nimittaja prameha, that is the sahaja prameha carried from their offsprings. These are the Atisthula Lakshanas. Clinically, you can identify all these Lakshanas. Atisthula Lakshanas. So, Javoparvata, so many Lakshanas Acharyas have enumerated. So, disproportionate distribution of the fat in the body or unwanted itching in the body. Patient comes to your OPD with a history of excessive itching in the body. So pruritus. Patient comes to your OPD with only this Lakshana. It is we have to identify what could be the underlying cause. Just you are treating that particular patient on the guidelines of Kushta Chikitsa, patient will not respond. Sometimes they will respond if you have given Kapahara Chikitsa. But almost most of the time, Kandu is associated with the Prameha. So the underlying cause is Santarpana Nidana. The treatment lines you have to follow from the Prameha Nidana or Prameha Chikitsa Siddhanta. Acanthosis nigricans. So pain or acanthosis nigricans. Blackish discoloration of knuckles or the axillary region or the neck region or the waist region. So that shows insulin resistance. So how you are going to identify with acanthosis nigricans. Recurrent infections. A patient who comes to your OPD with a recurrent urinary tract infection. Recurrent infections is also one of the cause for underlying Prameha Roga. So you have to rule out whether the patient is suffering from Prameha or not. You go with one fasting or one random blood sugar or one HbA1c, or simplest of the simplest is 50 rupees of one microenteric or one uric sugar. That's it. So blood division will be there or parastation will also be there. So less lifespan, restricted mobility, then sexual dysfunctions. Both male and female sexual dysfunctions are there. So weakness, or there will be a durgandha from the sharira or from the oral cavity. So excessive sweating, excessive hunger, similarly excessive thirst and excessive urination, especially the patient gives you a history of nocturia. So patient gives 3 to 4 times I passed the urine at night time, I could not able to sleep. So they are the basic things you should understand. You can go through all these 6 important things with which you can identify early stages of Santarpanotthyanis. Patient BMI is normal, but if patient presents with all these things, you can identify the underlying causes Santarpanotthyanis. Start with the Landhana and the Mokshana Chikitsa. That's why, what do you think? The circumference of the abdomen is more than 80 cm in women and 92 in men. So local darkness of the skin, an excessive amount of dry and rough skin, and acne or multiple skin tags. Most of the patient comes to your OPD with a freshly popped up skin tags. It was not a 1 month back, sir, now it has come. So they came to you with a history to get rid of only skin tag. The underlying cause is insulin resistance, patient is pre-diabetic in future. So to you, it is we, only this is applicable to Ayurveda doctors, that we are going to prevent or reverse Santarpanotthyanis or reverse diabetes. You have seen so many advertisements on reversing diabetes. One patient is paying 1 lakh rupees for 1 month, 1 year. They have to subscribe. Now they are subscribing channels now. So they are subscribing for 1 lakh rupees for 1 year, reversing diabetes, reversing thyroid disorders. So yearly if you target 1000, just 1000 into 1 lakh, how much you can earn. So many things are there. From the poorest of the poorest, for the richest of the richest, I will like every practice. Right. Question answers. Prameha hetu kapha sarvam. So all the kapha prakopaka nidanas are prameha hetu. That is the basic punctuation. Now, the first question: what are the rasas which aggravates kapha dosha? Madhura, Amla and Lava. मधुर से भी कफ वृद्धि होता है, अम्ल से भी होता है, लवण से भी होता है. चिकित्सा क्या करेंगे? अति मधुर रस सेवन से क्या होता है? अति प्रीणन होता है. अति लवण रस सेवन से क्या होता है? अति अम्ल रस सेवन से कौन सा कफ वृद्धि होता है और चिकित्सा क्या है? So we have to identify clinically whether the patient has a history of ati madhura rasa sevana janne kapha vruddhi, ati amla rasa sevana janne kapha vruddhi, ati lavana rasa sevana janne kapha vruddhi. If you are able to identify that, the line of treatment will be very appropriate. Otherwise it is not possible. We cannot prescribe a single medicine or single yoga or a single drug or a rasa or area for all the clinical conditions. That is what is explained in Ayurveda, avastha behavior. You cannot prescribe randomly to anyone. No standard protocol for all the people. That is what Purisham comes into picture. Otherwise a single drug will be prescribed for all the patients. It is not possible. Especially in Santarpanotthyanis, it is not at all possible. Any medicine is not possible. In this particular context, it is not possible. Can you tell me? Madhura rasa kleda vruddhi. By what process? By ati preenana. Excessive deposition of kapha in the layer inside the body. So ati preenana. So transformation is getting different. Agni has got two ends. One uptake and second one is utilization end. uptake from the gut, utilization from the dhatu. So that is why Agni has got two. ये पाचक अंशाः धातुषु संश्रिताः. So the amsha of the Jatvagni which are there in the dhatus doing metabolic activities in the dhatus. That is why we have Agni has got two ends. One uptake of nutrition from the gut. The nutrients are getting further metabolized and incorporated and stored inside in the form of nutrition inside the dhatus. So dhatu में व्यापार starts there. Then utilization of stored energy for the physical, physiological and psychological activity of a body. That is how the dhatu utilizes the stored energy inside the tissues or the organs or the systems. That is why Atipriyana becomes what is the line of treatment for Atipriyana? What is the Siddhanta for Atipriyana? Madhura Rasa, Kapha Prakopa, Mela Drishti. The line of treatment would be Apakarpana. One, okay, common line of treatment in all the three. One is Apakarpana. Very specific. Langhana or Apakarpana. Then very specific. Madhura Rasa exactly opposite Chikitsa Siddhanta. Right. And the next one, Amla Rasa. अति अम्ल रस सेवन से भी क्लेद प्रकोप होता है. तो क्या होता है? कौन सा क्लेद, कैसा क्लेद प्रकोप होता है? तो चिकित्सा तो चेंज होगी ना. अम्ल रस ज्यादा सेवन करने से क्या होता है? चरण चेंज क्या होता है? अति अम्ल रस सेवन करने से फोर्थ चैप्टर चरण चिकित्सा में क्या बताया? अम्ल रस अति सेवन से क्या हो गया? क्या होता है धातु में? ज्यादा लिक्विफेक्शन होता है ना. एक्सेसिव फ्लूइड इज इंक्रीज इनसाइड द बॉडी ना. हाँ, तो क्लेद का ज्यादा उत्पत्ति होता है. जो भी क्लेद वाला धातु है, क्लेद का दोष है, कफा पित्त है क्लेद में. So all the liquid factors in the body are getting accumulated. Then what will happen? What will happen? And in such condition, what is the line of treatment? वो भी कफजल, वो भी कफ विकार ही है, वो भी प्रमेय संप्राप्ति में भी आता है. तो प्रमेय का चिकित्सा करते हुए सिर्फ कफक की चिकित्सा देना नहीं है. कफक की चिकित्सा करते समय क्या देना है वो इम्पोर्टेंट है. विषंदन होता है अति अम्ल रस सेवन करने से. अति विषंदन होने से क्या होता है? धातु सिंचने स्वित्यस्तेन समृद्धि हो. पता ही है ना. तो excessive fluid is getting leak out from the tissues and getting mixed up with the circulation. So excessive fluid is increased in the circulation. तो उसको कैसे निकालेंगे हम? उधर भी कफक की चिकित्सा करते हैं. उसी तरह अति लवण रस सेवन करने से ही क्लेद वृद्धि होती है. तो इधर कौन सा क्लेद वृद्धि होता है? इधर भी क्लेद वृद्धि होता है. मधुर से भी हुआ, अम्ल से भी हुआ, लवण से भी होता है. लवण से वृद्धि, लवण से क्लेद जब वृद्धि होता है वो रिटेंशन टाइप ऑफ क्लेद वृद्धि होती है. इसलिए बहुत सारे मूत्र विकार में, मेदो-परावाह स्रोत विकार में हम लवण रस का अपठ्य करते हैं. There will be a retention of fluid. अति लवण रस सेवन करने से, that is why there will be a reduced urine output. तो जब यूरिन आउटपुट रिड्यूस होता है तो आप क्या करोगे? तो वो चिकित्सा इधर करनी चाहिए. इसलिए सिर्फ कफक अच्छा सर्वम ऐसा ही बोल के सिर्फ कफक की चिकित्सा करते हुए सिर्फ कटोरे से ही आप देते जाओगे, आप एक तरह से देते जाओगे, कषाय से देते जाओगे, तो इधर चिकित्सा नहीं होगा. इसका इंटेंशन क्या है? So all santalpanotha vikaras, santalpan is the line of treatment which has been explained. ऐसा तो नहीं हो सकता ना. तो चरक जी का स्निग्धस्य योगा विविधाः प्रयोज्याः कल्पोपदिष्टा मलशोधनाय दोषशोधनाय ऊर्ध्वं तथा अधश्च मदे अपनीते दोष अपनीते वेहेषु उत्तर्पणमेव कार्यम्. तो अपतर्पण चिकित्सा करने के बाद ही संतर्पण चिकित्सा करने का intention to the brain. All Santarpana Vikaras primarily treated with Apatapana Chikitsa, followed by Santarpana Chikitsa. चिकित्सा क्या है? शिलाज, गुरु, गोमूत्र, विधवा, लोगा, all these things which are being self-explanatory. तो धर्म जी का कमेंट्री अगर देखना पड़ेगा. विरुक्षण, what is विरुक्षण? मेदोघ्रम. Two things you should remember in this particular श्लोका. पहला last one. विरुक्षण, क्लेद आचूषण. विरुक्षण से क्या होता है? क्लेद का आचूषण होता है. जो पहले दो कंडीशन में क्लेद वृद्धि हुआ है, क्लेद का आचूषण करना है. तो क्लेद आचूषण कैसे करोगे? क्या वो धातु में रहता है? नहीं, वो सर्कुलेशन में रहता है. जब क्लेद वृद्धि होती है, क्लेद का आचूषण करना है, तो क्या चिकित्सा करनी होगी? रूक्षण चिकित्सा करनी होगी, लेखन चिकित्सा नहीं करना है. लेखन चिकित्सा कब करनी है? लास्ट में करनी है. क्या करनी है? लेखन चिकित्सा. So baddha and abadhamita, two clinical conditions are there in all the Medo-Pranavaha. In baddha you have to go with lekhana chikitsa. In abadhamita you have to go with rukshana chikitsa. Both the entities are different. And in lekhana chikitsa, when you are getting atherosclerosis, when the srotuses are getting blocked, you cannot prescribe directly lekhana chikitsa. उसके लिए गाइडेंस दिया गया है. पहला चिकित्सा क्या होगा? हेतु परि चिकित्सा करनी चाहिए. क्या हेतु होगी? इधर साम कफ अवस्था होगी, साममेद अवस्था होगी. कफ और मेद का कारण क्या है? आम है. तो आम का पाचन करो, उसके लिए लंघन करो, या उसके बाद आप जाओ रुक्षण. अगर वो सर्कुलेटरी फैट है, सर्कुलेटरी ट्राइग्लिसराइड्स है, अगर वो बद्ध में है, तो पाचन करने के बाद लेखन करो. Without giving pachana, if you are administering lekhana chikitsa, what is the complication? क्या हो सकता है? स्रोतस में ब्लॉकेज है, तो आप लेखन करना है, गूगल दे दिया, शिलाजित दे दिया, या कोई भी लेखन हमारा वस्ती दे दिया, तो होता क्या है? कटु रस है, श्रेष्ठ द्रव्य है, श्रेष्ठ रस है, जो लेखन को, जो कफ को it breaks into smaller and smaller particles and removes it. अगर साम कफ है, साममेद है, तो वो smaller and smaller particles में break हो गया, तो वो कहाँ जाएगा? Where it will go? It will go and blocks in the microcirculation. The microcirculation. So what is the complication? There will be blockages. You try to remove the bigger particles, but bigger particles are broken down into smaller particles. Because it has got ama associated, it goes and blocks further, because ama has got more stickiness. It goes and blocks into microcirculation, produces further complication. MI or severe. So most of the patients, whenever we go for thrombolysis, this is the basic complication. That is why whenever kapha or meda producing atherosclerosis, you should not supposed to prescribe lekhana chikitsa in the first instance. The first line of treatment is langhana, second line of treatment is pachana, third line of treatment is lekhana. It has to be adopted step by step. You cannot mix all the drugs together and prescribe. You give only one drug in one avastha. You tell 500 rupees, 1000 rupees, 2000 rupees or 5000 rupees consultation. But you give one medicine in one avastha. That's it. You need not to earn money from the medicine. You earn money from your intellect. So that is why it is very, very important that we are considered to where to adopt rukshana, where to adopt lekhana. What is this? We think that by sleeping we do not consume much of the stored energies. If you sleep properly, the santarpana vyadhis can be reversed in an appropriate time. So that is why nidra yattam sukham dukham, what it has been explained. If you sleep correctly in the right time and wake up in the right time, your body utilizes 65 to 75% of stored energies from the body. What we think, by doing more physical activity, we spend more energy. Exactly opposite. So that is why sleep in right time, wake up in right time. Exactly one cause. So sukham, dukkham, pushtim, kausham, everything depends on the proper sleep. Right. Ready for it? Ready to answer? Which gunas of kapha prakriti are genetically predisposed for metabolic disorders? Identify the guna. Which gunas of kapha prakriti are genetically predisposed for metabolic disorders? More susceptible for genetic disorders. Charaka Vimanam 8th chapter. Question from Charaka Vimanam 8th chapter. Next question. Which saga is more prone for metabolic disorder? Then question. Which type of samahana is more susceptible? Which are the three important dhatus involved in samahana? Anivishta Shonika Mamsa Asthi. So to assess body mass index, you have to assess three important dhatus. What are the three important dhatus? Anivishta Shonika Mamsa Asthi. So three important dhatu you have to assess for assessing the samahana. Right. Next question. Which satmya is more vulnerable? Which satmya is more vulnerable for Medo-Pranavaha Sroto Vikaranam? Which satmya? Ekarasa satmya? Or Shadrasa satmya? Or Moderator satmya? I mean, I am giving you a wrong option, so still you are giving the correct answer. Right, go to the answers. Time कम है इसलिए मैं जल्दी जाऊंगा. तो चरक विमानस्थान एक चैप्टर में इधर स्निग्धा मधुरा गुरु विजय वाचा. So they are the gunas which are responsible for that. Right.
Moving on to the next Vyadhi, I request Dr. Mahesh Salimath sir, can you please put on the slide. RW. See, Dr. Pramod ji जो है बहुत ही स्मार्ट काय चिकित्सक है. Whatever the Vyadhi he is trying to explain here is being using the modern technologies, right? Modern technologies most of the time. But when you see whatever he is trying to explain, it is nothing but kupidanam hidoshanam sharire parihavatah yatra sanga bhavaikunyah vyadhi tatrupeta. Whatever the disease occurs, it all depends on this basic siddhanta only. And this is the need of the hour for we, the Ayurveda people, to explain our system in the modern technology so that the whole entire world is looking at us. That is why I call Dr. Pramod ji a very smart Kaya Chikitsa. Right? And now I request Dr. Mahesh sir to throw his view on this particular point, resting energy expenditure, how it is helpful in the Vyadhi Upashaya and Vyadhi Nirodha.
So, good afternoon to everybody. To start with, myself, Dr. Mahesh Salimath, very bad seminar speaker and a very good classroom teacher. I am a very bad choice here, off and out, as because I am here only because of Sroto sir. So start with REE, that is so very important that why we sleep. What is the intention of going for sleep? This is what we have to understand here. As because the purpose of sleeping itself is not to pass night. It is to restore or to restore. Your intention of sleeping should be restore or restore or rejuvenate your systems. If you are restoring, if you are resting and if you are rejuvenating your systems, then none of the diseases, not only Medo-Pranavaha Sroto Vikaranam, not the Pranavaha Sroto Vikaranam, but all the 13 types of Vikaras which are there with Srotas will be under your control and you will have a good energy with you. You are what you sleep and you are what you eat. This is a very new concept which is been practicing since decades or years or ancient times since. But we are discussing it in a very different way by taking the help of internet and all. But intention of going all this is rapid movements are needed, sleeping in an appropriate time with quantity and quality. Sleep is a requirement for a healthy and steady. Now, coming back to as the topic belongs to the Medo-Pranavaha Sroto, sir has discussed about Chikitsa, whereas my role is to discuss about Yoga. If starting with the intention of going for Yoga among us the Indians itself is wrong, what I personally feel. Because we all are practicing Yoga with the intention to either reduce the weight of the body or to increase the flexibility of the body. Where there is the intention or the quote of Yoga itself is Yoga Chitta Nirodha. That means we should practice Yoga to control our mind, not to control our body. Control your mind so that definitely your body will be under your control. Many times and all the times. You don't want to increase your weight, but you never stop yourself from eating sweets or paddy puris, which are the junks, which are the continentals, which are the Chinese, which are not needed for the body. Which means, if we are going to have a control over mind, definitely we are going to have a control over our body. This is what we have to understand from Yoga. The first shloka of Yoga itself starts with Yogena Chittasya Padena Vacha. Yoga is to be practiced to control your mind, not body. Understand this first. So secondly, we will discuss the next part, which is Ayurveda. That is, if at all you have any diseases, then go for Ayurveda. We will discuss it later on. So coming back to Yoga, Yoga is a part and parcel of Ayurveda, which we know since ancient times. So we have to give respect to the Yoga and all along with the Ayurvedic treatments, as because it is very clear that the diseases which are due to Medo-Pranavaha Sroto Vikaras are due, whatever the diseases are there, we have to consume tablets for a lifetime. We have to undergo treatments for several days or maybe for months. That means person starts feeling bored, person starts feeling why it is, etc. questions comes in their mind. That means the intention of practicing yoga should be Satata Adhyayana and Vairagya. These are the important things which you should understand here. Satata Adhyayana is continuous practice, Vairagya is get rid of the things which are either disturbing you or creating diseases in you. That's what you have to understand here, and you should start practicing yoga. That's why the quotation of yoga itself is Samarpam Yogam Uchyate. That means to have control over body and mind, you should practice yoga. As already sir has not left anything to talk me regarding the Medo-Pranavaha Srotos and all. That's why I directly come to the yoga itself. So yoga is Chitta Tatha. Yoga Chitta Tatha. That means here you are going to again control the mind. That means the intention of practicing yoga should be control the mind rather than going with the other things which are there in the. And why yoga is a question to be asked by everybody who was sitting over here. As because the first thing is yoga is a drugless therapy. The world is in search of prevention. The world is in search of drugless therapies right now because almost everybody is suffering with one or the other related disorders of Medo-Pranavaha Sroto Vikaranam in every single houses all around the world right now. If we want to stop this, we should go for a yoga and other alternative, whatever therapies are there, we should get joined with that and start Ayurveda along with that. This is what is my intention to say you. And the second one is body and mind relation. Yoga is one of the very important practice which unites your body and mind. That means whenever you want to have a control over your kaya and manas, practice yoga all along with other whatever medications you are going with. We have hundreds of side effects with all other systems of our medicines. Only system and only very good system which has no side effects, which will give you the meaning goddess or the word goddess gain is yoga. That means you are going to get buy one get one free. Such a science means that is yoga. That's why practice yoga again. And discussing about the cost effective. So is calculating the lakhs together here. And yoga is a cost effective therapy. What is the need of a yogic aspirant or a yoga practitioner is a mat. You don't need anything more than a mat, maybe a loose or a track pants. That's it. That means to have a economic, not to have an economic burden also, you should practice yoga. Followed by yoga is not just a science, it is a scientifically sound, scientifically proven science since ancient times. That means you must involve yourself in yoga again, and it is a socially acceptable now. We should thank our Honorable Prime Minister Shri Narendra Modi ji for this particular thing, as because he has made it a global science now. More than 200 or 250 plus countries are practicing yoga now. That means Ayurvedic students should practice yoga now, so that you are not a doctors, you are a yogic doctors. So this is one of the things you should remember and you should practice it. And the one of the science which is 100%
sorry to interrupt, sir. Pertaining to Prameha, what has been discussed so far, I request you to tell some of the regular yogic postures which are beneficial for the patients at our day-to-day OPD clinics. Can you please throw some light on some regular asanas or some yama, niyama, asana, pranayama, pratyahara, whatever the Ashtanga yogas have been told? Can you please explain those things?
So first of all, there is a mistake with us is that yoga means everybody is practicing either asanas or pranayama. They have neglected the first part of yoga, that is Shatkarmas. Without purification, without yogic purification, if you practice Ashtanga yogas or mudras and bandhas, that's not going to give you the textual benefits, or that's not going to give you the fullest benefits of yoga. That's why whomsoever is Medasara or Kapasara Parishad, they should undergo Shatkarmas followed by Ashtanga yogas and then mudra and bandhas, which are, if I speak them in modern language, always Shatkarmas acts like antibiotics, whereas Ashtanga yogas they work as a symptomatics, and mudra and bandhas will always going to act as an antacid scale for you all and for all of us. Coming back to the point of source, specific yogas should be practiced under expert gurus first of all, followed by you should not practice with the Asta channels or by David Cross and all. So expert gurus is a need. Starting with Matsyasana is the fish pose, is a very beneficial practice which is going to be very beneficial in those who are in the first stage of diabetes and all. As because this is one of the very important questions which will massages the thyroid gland and other related spinal related things which are associated with it. Pramod is one of the very important practice which should be practiced so that whole of the apana vayu is removed from the body, so that the waste, the metabolic waste, the morbid waste, the toxins present in the body will be removed, and that is one of the very important practice to be practiced in Medo-Pranavaha. And Bhujangasana, the cobra pose, where the whole of the spinal cord is involved, which massages the whole of the spinal cord, which irritates the neck, and which massages the thyroid gland. That's why it is again one of the important practices which can be practiced. Sarvangasana is there, that can be practiced. Even the Trikonasana is one of the very good practice can be practiced in this regard. Followed by Yoga Nidra as discussed earlier. Yoga Nidra is a need. The Kapalabhati is one of the very important practice can be practiced amongst Shatkarmas, and there are mudras now. Mudras can treat any diseases, even Vayu Mudra and Apara Mudra can be practiced in this regard.
Thank you, sir. Mrityunjay is available? Dr. Mrityunjay? Now I request Dr. Pramod to continue with the second Vyadhi. Again, my request to the audience is, whenever you are looking at the PPTs, whenever you are listening to the explanation, keep in mind Kupitanam Dosha. Then only you can understand.
One more important disease under the group of metabolic disorder or Medo-Pranavaha Sroto Vikaranam or Sankalpanotthara is hypertension. There are many technical words, dissertations, theses, titles, research articles were published on hypertension in more than 12 different names for the disease of hypertension. So I am not going into all the words which have been used for an alternate word used for our forceful giving a Ayurvedic name for hypertension. The objective of understanding hypertension is, when you diagnose it as hypertension, what is your treatment? You will diagnose it as a patient is suffering from hypertension. And how you are going to approach, from where you are going to start, that is very, very crucial. So unless understanding what you are going to prescribe and from where you have to start the treatment, giving name for the hypertension in Ayurveda is of no use. So Vyadhi Namakarana Siddhanta, what is there in Ayurveda, accordingly if you give name for hypertension, then okay, to some extent it is accepted. Otherwise it is not. So there are two types of hypertension, everybody know this. So Swatantra and Paratantra from Ayurvedic perspective. So benign or mild, moderate, severe, then renin or low renin type of essential hypertension. So hypertension is origin from the either cardiac, either psychogenic or either renal or endocrine disease. So if you want to treat hypertension, you have to look into all these basic things with which you are going to prescribe. You cannot give single drug for hypertension in Ayurveda. Right? So, what is hypertension kriyakalas? You have to understand, no? Kriyakalas of hypertension. What is the first one? Sanchaya. Where Sanchaya happens in hypertension? चिकित्सा वहां से शुरू होती है। तो संचय कहाँ होगा? हाइपरटेंशन कहाँ होगा? पक्वाशय से होता है। हमारे पास तो दो ही है ना ऑप्शन। व्याधि उत्पत्ति कहाँ से होती है? तो संचय कहाँ होगा? आमाशय से या पक्वाशय से? कोई भी व्याधि ले लो, वही से ही होता है क्योंकि दोष फॉर्मा रहता है। नेक्स्ट प्रकोप, प्राणवाह स्रोत, we'll discuss that point later. Right? Prasara, sarva sharira, through rasarakta. Next, sthana samshaya. which part of the body is more vulnerable, more susceptible, where curvature is there, where less immunity is there dosha goes and settles down, thus dosha and dosha samochana. If Prakrutika dosha is a kapha and goes and settles down in Vrika, produces hypertension. What is the line of treatment? Sarpagandha? Can you use Sarpagandha? You cannot. If Prakrutika dosha is a pitta, it goes and settles down in Rakta Yakrita Priya, then what are you going to give treatment? Similarly, if Prakriti dosha is a vata, it goes and settles down in Najjadhatu, then what is the line of treatment? So that is why it is not only the single drug or a herb to be prescribed under the context of hypertension. It is a treatment principle has to be followed and understood. Otherwise, the management of hypertension becomes just disease and a drug. So Ayurvedic doctors are not a disease and drug doctors. We are not a DDs. We are above that. We are moving from Vaidya Vritti to Bishop Vritti. We have transformed ourselves to the Bishop Vritti. Right. So Vektasthana, obviously, which system is involved, which organ is involved. Sometimes you get Savasharira Lakshanas, sometimes localized Lakshanas can also be observed. Sometimes patient comes to you with a history of edema. You check blood pressure, it is increased. What is the line of treatment? Beta blockers, calcium channel blockers, AC inhibitors? No. It's simple diabetic. One Punarnava, one Gokshan will increase the hypertension. No need to go for multiple drugs for there. Are you getting the point what I am talking? So, it is not only the Vyadhi with which you are treating. What is the exact underlying Samprapti and Samprapti Vikaranam Chikitsa you are going to establish with your treatment is very, very important. That is why in Bheda, what will happen in hypertension? Multiple complications, multi-system involvement. One Sroto species, another Sroto, one Dhatu species, another Dhatu that you are studying in 5th chapter of Charakima. The same thing you have to identify and understand in all other modern diseases. What is the Hetu Viparita Chikitsa? Ayurveda has got only 3 treatment principles. The first line of treatment is Hetu Viparita. You take any disease, identify the Hetu, prescribe Hetu Viparita Chikitsa. What is Hetu Viparita Chikitsa in hypertension? Now it is clinical class, not Samhita Adhyayana, Samhita Parayana. Right? All the 4.5 days, we have studied Samhitas. Good, that is basic thing, it is must. Without which you cannot explore this. Right. What is the Hetu Viparita Chikitsa in hypertension? रोग का हेतु क्या होता है? हेतु क्या होता है रोग का? मिथ्याहार क्या होता है? हेतु here. In Chikitsa, it does not come. Like it comes under the group of Pathya. There is also a treatment, but there is not a Hetu Viparita Chikitsa. For every Vyadhi, the Hetu is either Ama, the Avastha of the dosha. Depending on that, the Hetu Viparita Chikitsa comes into the picture. Doshas are in Samavastha, Viramavastha, Nalina, Purana, Jirada, Adhina, whatever it is, that is the Avastha of the dosha. That is, you have to identify. So you have to go within the line of treatment of Samavada, Samapita, Pachana of the dosha, Pachana of the dhatus. So best drug of choice is? Best drug of choice in all the Hetu Viparita Chikitsa is simplest. It is available in everybody's home. What is Anuloma? Where you get the definition of Anuloma? Standard? One more definition is also there. Standard? Okay. Suprasthana? Second number? What is Pitta Anuloma? Kapha Sarvam. Pitta Anuloma. Kapha Pitta Anuloma. Vata Anuloma. What is Pitta Anuloma? Tell me one drug for Pitta Anuloma. Best drug of choice for Pitta Anuloma. Single drug. What is the guna I am trying before making Pitta Anuloma? Which guna you are going to target for making Pitta Anuloma? Which guna is responsible for Anulomana? Out of 20, which guna? Sarva Anulomano Prokta. Very good. So tell me one way which acts on Sarva of Pitta. The Vyadhi is born out of Medo-Pranavaha Sroto. The line of treatment what we are adopting? Sarva Anulomano Prokta. What is the connection?